Next, I'm going to cover nasal sprays. The key with nasal sprays is the first step is to have the resident blow their nose. Honestly, it's not going to do any good if you're just spraying boogers, so have them blow their nose, clear that out. First thing you're going to want to do is shake them. You'll have the resident breathe in and out, normally a few times. Insert it into the nostril about 1/4 of an inch, and then you're going to want to actually point it up towards the eye. And then have them cover the opposite nostril. So I'll show you that. So look like that. Make sure you're storing your nasal sprays in your medication carts upright. If they're not, sometimes the tip can become clogged. If the tip of the applicator does get clogged for any reason, you can pop off some of them and run them under warm water to clean them. When they are breathing it in, just breathe in normally. A lot of residents will go, they don't need to snort it. It's going to get where it needs to go. Because if we look here, so as you can tell, the medication's gonna get to where it needs to go. And then the first mistake that people make in placement with the nasal sprays is they tend to put them in and point them towards the center of their nose, right at the septum. What happens when you do that is over time, there's actually a deterioration of some of those small bones in there. You also can increase the amount of drainage at the back of their throat, so they'll be coughing more, it'll be a little more uncomfortable. And then I've personally experienced this last one. If I tilt it in too much, you can get a shooting pain at the back of your head, very similar to like a brain freeze. Very uncomfortable. Don't do that to your residents.